night of having a newborn baby, families are often very, very excited because of the joy that comes with a new member or a new addition to the families. Everyone is anticipating to see the milestones, and there's so much that is happening around the baby. We take so much care, but sometimes we are overtaken by the joy. And sometimes things may not go as anticipated. Sometimes this joy is cut short by so many reasons. There are several causes of mortality in children that we've seen on different occasions on different shows, and some are actually unintentional causes of death among children. It has been seen that about 1.72% of children die unintentionally, that is under the age of 5, with the cause of death not really ascertainable. There is something that occasionally tends to cut their lives short, and that is sudden infant death syndrome. It is actually here with us. It is very common, and studies have shown that about 7.8 cases per 1,000 live births. Just imagine every 1,000 babies that are born, about 8 annually lose their lives to this condition. That is sudden infant death syndrome. And that's our discussion this week. Now, on the Pediatric Voice, we are going to discuss sudden infant death syndrome. With me, Dr. Helen Namsoke, your host, and our pediatrician. We are privileged to host Dr. Charity Mutenyo Chibone, who is a medical officer at the Bethany Women and Family Hospital. She works in the Department of Pediatrics and Child Health. She studied at Mbara University of Science and Technology. She's very compassionate about child health, equitable health, and making sure that everyone receives the quality of life to the fullness and sustainability of lives. Thank you for honoring our invite, Dr. Charity.
Thank you to Dr. Helen for inviting me to this show today to talk about sudden infant death syndrome, which is a very important topic to share with the public.
Yes, so our viewers out there would want to have a greeting from you and to hear from you briefly.
Hello everyone. I am Dr. Charity Mutenyo, as introduced by Dr. Helen Namsoke. I'm glad to be here today to be your guest on this show, discussing sudden infant death syndrome. This is something we rarely talk about in our setting, but I am happy that we've gotten a platform to share information with you about this today. Thank you.
Thank you very, very much. Yes, as you heard from her, it sounds far away from us, but I know many of you have seen a friend, have heard of a friend who has had their baby otherwise healthy, but all of a sudden the life of this little one being cut short. And thus this discussion tonight. But before we delve deeply into the discussion, let's first have a documentary on the state.
Sudden infant death syndrome, sometimes known as crib death, is the sudden and unexplained death of a baby younger than 1 year. It is a large category of unexpected infant deaths. The cause of sudden infant death syndrome is unknown, but research has shown that it is associated with problems with a baby's brain center that is responsible for the control of arousal from sleep, detect low oxygen levels, and buildup of carbon dioxide within the body. Globally, about 2,300 babies die to sudden infant death syndrome, with a known prevalence of about 38.4 deaths per 100,000 live births. Children less than 6 months of age are more prone to sudden infant death syndrome, with about 90% being lost in the first 4 months of their life. Proper precautions must be taken to prevent sudden infant death syndrome and save the lives of our little ones.
So, Dr. Charity, that was our documentary for tonight. What is your comment?
Sudden infant death syndrome, like you've heard, it's really unpredictable, first of all, but also because it affects families greatly and causes great emotional pain, and has devastating mental health implications, it is something we need to talk about. In our African setting, we've not really heard a lot about it, because in our social cultural context, most sudden deaths will be attributed to things like witchcraft and other things, other spiritual things. But we are here to share information today because we believe that there are risk factors associated with sudden infant death syndrome, that if you have the information about them, we can address them, we can modify them and see a significant reduction in this. You might ask, how big is the burden of sudden infant death syndrome in our setting? Truthfully, not a lot of research has been done, but globally a lot of research has been done, especially in the developed countries. You have like the US, they'll give you a figure of 38.4 deaths per 100,000 live births. That means over 100,000 live births, 38 babies or over 38 babies will succumb to sudden infant death syndrome. Now, this is a developed country. They have put in place measures to reduce the risks of this happening. How about here in Africa, where we don't have the information, we've not put in place any measures? This means that it happens in our communities, but we do not get a hold of it because people just attribute it to other things. However, in the recent past, we health workers are starting to see more and more of it because of improved health-seeking behavior, as well as easy access to health care. And now that we know that it's an actual problem in our communities, we would like to address it today, and we would like to share information with you to reduce the risks of this.
Have you ever seen a case?
So yes, this year at Bethany Children's Clinic, we happened to receive a case where a mother just came with a child who was not breathing, who was dead. And the mother's explanation was she just woke up after putting the baby to sleep a while ago. She found the baby wasn't breathing, and what was shocking to her is the baby was otherwise healthy. The baby had nothing wrong with them. This baby was about 5 months old and very healthy, growing well, achieving their milestones on time, but suddenly they didn't wake up from their sleep.
Well, that's very sad. Personally, I've seen 4 cases in the period of 6 years, with 2 of them happening this very year, actually. One happened around Feb, and another one, I think, about June there. Yes, during my practice, I've made 4 cases, and it's actually very saddening to the families. And you know, it makes the whole health unit cold when you hear of the story of a child who was otherwise healthy and you know, all of a sudden just didn't wake up from their sleep. Yes, feel free to call in your friends to tune in to Bethany TV Uganda. That is on Facebook and YouTube. Share, subscribe, call in everyone who you can call to come and listen in to this interesting topic, and to watch the Paediatric Voice, where we discuss different interesting issues about child health. You can also watch us on Bethany TV Uganda, that is on X Spaces, and follow us on www.bethanytvuganda.org, that is on our website. And on GoTV, that is channel 841, and free to air on channel 170, that is on your decoder. Yes, Dr. Charity, what is sudden infant death syndrome? Maybe our viewers out there would want to understand it.
So sudden infant death syndrome, just like the term says, one, we need to understand who an infant is. An infant, in medical terms, is a child below 1 year of age. Anyone from 0 day of life to 1 year of age is an infant. So sudden infant death syndrome is as simple as the term says. It is a sudden death of an infant. However, it is unexplained because this child has been otherwise healthy. We didn't know anything, like this child has a brain complication, or this child has a heart complication, or this child has this disease. Suddenly one day we just wake up and the child is not breathing anymore. That is.
So you mean a parent had their healthy child, growing well, feeding well, and everything going well, and then they just wake up one day and the child is normal?
Yes, please, Dr. Helen. So it also usually happens during sleep. So you put your baby to sleep, and you maybe go do some other things, or you're also asleep, but when it reaches time for waking up, you notice the baby is not waking up. You go to check on them and you realize they're not breathing. Okay. So that is sudden infant death syndrome.
Okay, what really happens? Because if my child was otherwise healthy, why wouldn't a baby who went to sleep healthy fail to wake up from their sleep?
Okay, like we saw in that documentary, the most common thing that has been attributed to cause sudden infant death syndrome is problems in the brain center that is responsible for waking from sleep and respiration, as well as catering for our heart. So there are a lot of factors that will go into causing sudden infant death syndrome. One of them is you have a fragile infant or a vulnerable infant. This is almost any infant, but especially we've seen that more than 90% of the cases are in babies below 6 months old, and especially between the 2nd and 4th month of life. So those babies are very at risk. So that is one of the factors. You have a fragile or vulnerable infant. Then you also have an infant who is at a stage of development where their body is still trying to learn how to regulate and balance certain activities happening in their bodies, and you have an external stressor. So I will use the example of a baby who is 4 months old, and you put them to sleep. So usually it happens to babies who are put to sleep lying face down, lying on their tummy. So usually these babies are not able to easily turn in their bed. Their motor skills are still developing and they're unable to turn. So usually in that position, we all breathe in oxygen and breathe out carbon dioxide. So when you breathe in oxygen, you breathe out carbon dioxide. In that position, for a baby, they will end up breathing in again oxygen, but with some carbon dioxide, because the air is trapped under them. So they will breathe in.
At that age, actually, they depend on so much on their abdomen to breathe.
Yes. So they'll keep breathing in the carbon dioxide they are breathing out. Our body, our organs need oxygen to thrive. However, the more carbon dioxide they breathe in, the danger worsens, because carbon dioxide rotating in your blood means there is less oxygen to go to the organs, and this also compromises the brain center that is responsible for breathing. It gets confused and it can no longer regulate the breathing very well, or the arousal from sleep. Most babies can wake up in that case, like the carbon dioxide levels being high can stimulate the brain center to alert the baby to wake up. However, with those with brain defects, which are unidentifiable, they will not be able to wake up, and this will cause them to pass away in their sleep.
I'm trying to internalize your statement.
Yes.
So there is a center in the brain,
yes,
that is responsible for breathing, and this controls the way you bring in your oxygen, that is breathing in,
yes,
and then you breathe out your carbon dioxide, right? Yes. So in the event that you're not breathing well, it switches on and off, right?
yes.
So what stimulates this center to wake someone up?
So high levels of carbon dioxide in your blood.
So if I have high carbon dioxide in my blood, that means I've not breathed it out very well.
Yes.
So this center is like, hey, Helen, wake up. You need to breathe out this carbon dioxide,
yes,
right?
Yes, please.
So what happens with these babies?
So with these babies who have brain defects, whereby the respiratory center or the arousal center or the waking up center is unable to trigger that response of waking up the baby, they will not be able to wake up. So more carbon dioxide accumulates, oxygen is cut off to the organs, and that means death.
I'm getting two things here. So because I imagine even during sleep, someone should be in position of breathing in oxygen and breathing out carbon dioxide.
Yes.
But when someone has an accumulation of carbon dioxide, and they can't easily breathe it out, maybe because they are lying down on their tummy. And remember, we earlier said babies depend on their tummy to breathe. Maybe because they are lying down, so you can't easily blow it out. So it accumulates in the body. And ideally, the brain center is supposed to wake up the baby.
Yes.
But this time around, even that fails to happen. So it is that means, does that mean it's a series of events?
So it is a series of events. Like I had mentioned, again, there are lots of factors. So again, you have a vulnerable baby. You have the issue of they're at a developing stage where their bodies are still learning how to regulate certain things, and that includes the brain and the brain center responsible for respiration and waking up. And then there is an external stressor. In this case, that external stressor is putting the baby to sleep on their tummy, which is supposed to help them to breathe in and out effectively.
Okay.
Yes.
Okay. Is there a way one would know a baby that is at risk of this condition?
So yes, because we've heard from the documentary, there is no known cause of sudden infant death syndrome. It can be confusing, and because of its unpredictability and no answers are offered to parents or families that lose their babies this way, it is important for us to understand the risks associated with it, or the things that will increase the possibility of sudden death infant syndrome happening, because when we know these things, we can work on them and reduce the risk significantly. So I'll categorize the risks in two different categories. One of them is sleep factors, which are the most important, because we've seen that most sudden infant death syndrome happens during sleep. That means there is something about sleep that needs to change in order to reduce the risk. So one of the sleep factors that increases the risk is putting the baby to sleep on their tummy. Another thing is putting the baby to sleep when they're swaddled in a lot of clothes. So usually in the hospital, when you're leaving, we pediatricians
encourage parents to swaddle their babies.
We encourage you swaddle, keep the baby warm. But I think we need to revise how we give that instruction, because a lot of swaddling and a lot of bundling will cause overheating of the baby, which also disturbs the regulation of the brain center. It will cause...
I've actually seen parents, you find the baby is heating up and she insists, but this is a baby, babies don't feel hot.
Yes. So we also have that in African culture. I've had it a lot, but doctor, babies don't feel hot. You can't tell me to uncover the baby. No, that is not true. When you overswaddle the baby or overcover them, you increase their risk of sudden infant death syndrome. The other thing is having loose clothing in their crib or making them sleep on soft materials. We want our babies to be comfortable, so we shall get the softest mattress, we shall get a fluffy comforter, a woolen one, and put it under the baby, and on top of that put the baby to sleep facing down. That's almost a triple risk of sudden infant death syndrome. The other thing is physical factors concerning the baby. Babies with low birth weight or born prematurely are at a higher risk than their counterparts. Babies who are born with brain defects, most of them will be unidentifiable, like we've mentioned, and also babies who are born to mothers who have been smoking during pregnancy, but also babies who smoke, who are like passive smokers. They have parents or members in the household who smoke. Research has shown that nicotine, which is the substance in tobacco,
in the tobacco,
yes,
smoke, cigarettes.
Yes, that one. It will sort of have effects on a child's brain that we are not able to see clearly, but with time it affects the child's brain. And remember, we are trying to protect our brain center that's responsible for respiration and arousal. So I encourage anyone with a smoking person in their household and an infant, please do the right thing and protect the infant. The other things are maternal factors, like a maternal young age. Younger mothers or teenage mothers, say, are more likely to have a baby dying from sudden infant death syndrome, simply because they are less equipped, less
knowledgeable in the care for the baby.
Yes, basically. And also we've seen from research globally that male babies are more at risk of sudden infant death syndrome. For this one, I honestly can't explain, but yes, that's what research has shown.
Okay, thank you very much, Dr. Charity. You have very interesting risk factors, and actually, those are the things that we see in our day-to-day lives. But as we delve deeper in the discussion, still on the risk factors, let's first have a short break.
Bethany TV for health. Yo TV Super App presents the Black Friday Trolley Dash. Simply subscribe to any of the bundles. When you subscribe for a month, you have 20 chances in the draw. For a week subscription, you get 7 chances. And for a day, you get 1 chance. The winner will be getting 200,000 shillings worth of shopping at Mega Standard Supermarket throughout November. The Black Friday Trolley Dash, proudly brought to you by Mega Standard Supermarket, Yo TV, and Bethany TV for health. Ladies and gentlemen, we are thrilled to introduce Bethany Santa Omugabi, who will be sharing wonderful goodies with you this Christmas season. Getting a chance to meet Bethany Santa Omugabi is easy. Just tune into Bethany TV and get to know our various programs and talented presenters. Bethany Santa Omugabi will make surprise appearances during our live programs and offer Christmas hampers filled with an assortment of goodies, including healthy food items. When you spot Bethany Santa Omugabi during any of our programs, be the first to call in and say, "Hello, Bethany Santa Omugabi. I am your Christmas date." He will then ask you a simple question about our programs and presenters. If you answer correctly, you instantly win a mega Christmas hamper. But that's not all. You can also respond on social media. The first 20 people to respond to each question on social media will be entered into a draw. And lucky winners will be picked and announced during Bethany Santa Live on Saturdays. Bethany Santa Omugabi, only on Bethany TV for health. Bethany TV for health.
Back from the break, and thank you for tuning in to Bethany TV for health. You are watching the Pediatric Voice, and I'm your host, Dr. Helen Namsoke. Now, Christmas is here knocking at us. It is looking at us. We are eyeing December, and guess what? Bethany TV has come up with Bethany Santa. He is here to give us a lot of goodies. Feel free to watch Bethany TV, that is from morning to evening. The moment you see Bethany TV coming on your screen, call in very fast and just tell him, "Bethany Santa, I am your date," and he is there and willing to give you a lot of goodies. Don't not say that I didn't warn you. Don't miss out on these goodies. Let's enjoy Christmas together. Bethany TV for health. And yes, today we are hosting on the Pediatric Voice Dr. Charity Mutenyo, who is a medical officer at Bethany Women and Family Hospital, and she's teaching us of something very important that is here with us, that you've heard of, you've seen someone who has gone through it, or you've ever had someone who has suffered or lost their little one to it, and that is sudden infant death syndrome. And we defined sudden infant death syndrome earlier on before we went for a break, and before we cut we had several risk factors. Now, Dr. Charity, you talked about prematurity. Why you're worrying some of us who have had babies that are born too soon? You know, it comes with a lot of anxiety, having your baby before due time and so small. And usually I've interacted with parents that have had prematures. They're usually worried of will I go home with my baby? So now when they hear that there are some of the parents that have babies that are at risk of these seeds, maybe we need to know why.
Okay, So first of all, prematurity on its own and low birth weight presents different complications on a wide spectrum, but also a baby that is born preterm has a lot of other risks involved. One of the things is their development. The development of their organs is not the same as for a term baby. Usually they require a bit more time for their organs to catch up. Okay. So that means that includes the brain. And again, we are talking about the brain center being the most vital issue in this condition. So usually if your brain is less developed, then you are at a higher risk for not being able to regulate your oxygen and carbon dioxide. Your carbon dioxide levels raise and you can easily pass away during your sleep. But also, preterms have a lot of other things. They are more likely to get, say, respiratory tract infections, which are like flus, and that can also cause them breathing problems. They are more likely to be over-swaddled or overheated, because we are always recommending that
to swaddle them as much as possible.
As much as possible. And this also increases their risks.
Sometimes they're even in kangaroo, in the parent's chest. I've actually heard of several prematures that have lost their lives in the chest during kangaroo.
Yes. So also the baby carriers we use, they are fluffy, they are comfortable, because you know we have a preterm, and remember they're still on your tummy, they're in a fluffy thing, they are overheated. Generally the risk for preterms increases 5-fold because of all these complications associated with prematurity.
Okay, that is very interesting. Are there any other risk factors to sudden infant death syndrome?
Yes, there are a few other risk factors. One of them is family history. If a family has lost a baby to sudden infant death syndrome before, not to scare people, but it is more likely to happen again, because again, as we have seen, it is a combination of factors. One of them is brain defects that can be genetic. That can
brain
be
defects, you mean issues with the brain, abnormalities in the brain that have not been detected, maybe?
So that can happen as a thing that is passed down in the family through the genes, through the genetic makeup of the family, and because it has not been identified before, it can happen again in different generations. But also the way a family does things with one baby is they are more likely to repeat it with another baby. So family history is very important, and if you've lost a baby to sudden infant death syndrome before, sorry about that, my heart goes out to you. However, we are hoping that as we share these risk factors, we are able to modify them so that it may not happen again. Please don't get scared. This is something rare. It is not like it's going to happen to every baby who is put to the tummy to sleep, or every baby who is over-covered. The numbers may not be that high. The only thing we are saying is, because it is fetal, because it is brutal, because it has devastating mental health implications, we need to be able to identify these risks and modify them where we are able to.
You know, the saddening bit is, if it happens, we can't do anything to save a life.
Yes.
There's nothing like how do you treat sudden infant death syndrome. I mean, a life is lost and unexplainably lost, so we can't do much about it. But maybe this information goes out there to teach us, to make sure that it does not happen, and for those families that have lost their little ones, to make sure that they do not lose more. Now, when it comes to prematurity, you know, I love prematures, and November is a World Premature Month. It's where we advocate a lot about the lives of our babies that are born small and born too soon. So sometimes I hear some of the things you're talking about are some of the remedies we tell parents, the things they ought to do to keep their little ones alive and safe. We tell them to do kangaroo, we tell them to swaddle them as much as possible, and, you know, to cuddle with them, and so many other things. Yes. You know, so maybe what is your comment about those? What should they exactly do?
Okay. It is true, even us as health workers, as pediatricians, as doctors, we are complicit in some of these things. We give instructions, but they are not very clear.
Okay.
Really, we're just like, oh, swaddle the baby, cover them as much as you can, keep them warm. Those are some of the instructions we give. But to what extent? Someone is going to wrap the baby in 3 clothes, add 4 blankets, and add a comforter or something, and they have done what you told them to do. They are keeping the baby warm. So today I'm here to share that there are ways to keep a baby warm without
heating up the baby,
overheating them. So the thing with swaddling is we tend to use a lot of clothes, yet the more important thing is keeping the baby warm and not the amount of clothes you've used.
You wrap up the baby with.
So a trick to use is regulating detecting the temperature according to your body as an adult too. If it's hot outside and you feel like you're in a light clothing, please, why is the baby in 4 overalls?
5 or 6.
Yes, and 2 blankets. Please regulate the covering of the baby according to how you also feel. They should be more covered up than you, but still according to the temperature. And
actually, I would want to tell our viewers out there that the baby's body temperature changes with the environmental temperature. If you feel it is hot out there, the baby is more likely going to pick up that heat before you, an adult, pick it up. So they are likely to heat up faster than you do. And the reverse happens when it is cold. If it is raining, if you feel you're freezing, just know the baby will pick up the cold sooner than you will do. So if it is cold, please wrap up the baby very well. And if it is hot, reduce the coverings very fast for that baby. Yes. And these days with technology is very good. We have digital thermometers where parents can actually, I think, monitor the temperatures of their little ones. And I usually say the normal temperature is between 36 and 37 degrees Celsius. So if you check on your baby, feel free to check on the baby's temperature. That is morning and evening at least, and afternoon, 3 times a day. If you find your premature is sitting up beyond 37, that tells you that maybe you're over wrapping up the baby. So with time you get to know how many wrappings you need to put. And I believe in our setting, if you have 2 good cotton bed sheets plus 1 less heavy blanket, that is enough for a baby. Not so?
Yes. Another recommendation I would give is to concentrate more on what the baby is putting on. Those clothes are less likely to be loose and flying around in the crib. So maybe dress the baby in something inside, put on a warm overall.
They put on a vest,
yes,
and a warm overall.
And then on top here, you do not have to have a lot of beddings. It can just be a bed sheet and a single warm blanket, but also make sure that these are tucked into the side of their crib. You have no loose ends flying around, but also make sure that when you're covering the baby, the beddings stop at least at chest level. Many of us, again, swaddling, you just find the baby has disappeared into the beddings. You're looking for the baby and the baby's just not there. That is dangerous. So if we can learn how to put our babies to sleep in a proper way with warm beddings, but also protecting them, it would be really helpful.
Thank you very much. You've clearly given us the risk factors to this deadly condition. Unfortunately, if it has happened, it has happened. We can't reverse a life. But are there things we can do to prevent it from happening?
Okay, yes, Dr. Helen, there's a lot we can do to reduce the risk of sudden infant death syndrome from happening. A lot has to do with sleep. Like I had mentioned, a lot of risk factors fall in sleep factors. So think about it in a way that when a baby has to sleep, you have to think about where are they going to sleep. So many of us have cribs for our babies or cots. We need to ensure that those cribs have comfortable mattresses, however, that are firm. Like I said,
in our setting, African setting, Dr. Charity, we usually sleep with our babies. Is it actually safe to sleep with our babies? So
it is, truthfully, it is unsafe to sleep with the baby because a lot can happen. However, because of our setting, because of the circumstances we live in, we can make provision for it, but also put in place measures in case I'm sleeping with a baby. How can I protect them? How can I reduce the risk of this happening? But for those who can afford, I recommend that they get the cribs, a separate bed for the baby, still in the parents' room. Do not put the crib in another room. Let it be close to the parents
so that they can easily watch over the baby.
Exactly. But for those who get cribs, please get a firm bed for the baby. Get a firm bed that doesn't sort of fall in as the baby sleeps in. But also, when you are, whatever bedding you put on the crib should be a light clothing, just a bed sheet. A cotton bed sheet is enough. You don't need to put some fluffy wool under the baby. That increases our risk of sudden infant death syndrome.
So I'm looking at the fluffiness as the baby is trying to turn, maybe at 3 months, 4 months, they're trying to turn their head. It's a milestone, the gait. These fluffy things can easily cover their nose, right?
Yes, yes. Okay. So we need a light bedding on the crib bed, and then when we put the baby to sleep in the crib, we also need to remember that putting a baby to sleep face down is a huge risk factor. It is actually the biggest identified risk factor that we've seen for sudden infant death syndrome. So there was a campaign back in the US. They had seen a rise of sudden infant death in the 80s. And they decided to run a campaign. It was a big public health campaign where they termed it back to sleep. So back to sleep does not mean put the baby back to sleep. No, it means when you're putting the baby to sleep, put them to sleep on their back. Let them lie on their back facing upwards. Some people want to make them sleep on the side too. That is also not a good way to make a baby sleep.
So does that mean that babies should only sleep on their back? Won't they get tired of that position? Won't they get flat nips?
So it doesn't mean that a baby should always sleep on their back. No. Ideally, when a baby is sleeping, when you put them to sleep on their back. I know I've told many parents this, and their questions are, but my baby will get a flat head behind. However, there are measures to stop this. We are encouraged to keep checking on these babies as they are sleeping. But on checking on them, we also try to adjust their position from time to time. So when you're sleeping flat on the bed, it's like one point of the head is the one in contact with the bed under, but you can keep changing the baby slightly for small time, for small durations, and usually observed, just to distribute the pressure if you fear the flatness of the head. However, the flatness of the head will not, it's not a big risk on this baby. It does not cause any complications to their brain or their growth. So really,
it can actually even resolve on its own.
Yes, exactly. So it shouldn't be like a major thing to worry about. Another person will ask, doesn't sleeping on the back increase the risk for the baby aspirating? Aspirating means maybe what they ate going into their lungs. No. Research has shown that babies sleeping on their back does not increase the risk of them aspirating. So sleeping on the back for a baby is the best position. It's the most comfortable position for the baby too. Just that they won't tell us, but it is the best position for a baby to sleep. So I encourage all parents out there, when you're putting your baby to sleep tonight or any other night, please put them to sleep on their back and keep checking on them from time to time and relieving pressure on certain points.
Okay, thank you. I would ask my producer to bring back that picture of the baby lying in the crib. You see, Dr. Charity has been talking about of a flat crib. You see, when that baby is sleeping, the bed does not fall in. It still remains flat. So even when this baby tries to turn around, there is less risk of the clothing covering up the head for this baby. So in others, reducing the risk of suffocating for this baby. Now, Dr. Charity, in the African setting, we believe when the baby lies on their tummy, they are going to sleep longer. You see, we African mothers are usually having a lot of engagements within our homes. We are not only watching the baby, we are the same person. We are doing so many house chores on top of nursing this new addition to the family. So we prefer a baby who sleeps longer so that we have time to do so many house chores that are happening around, and also taking care of the other bigger children. So we believe that if a baby lies on their tummy, they will sleep longer. And that's why we prefer that position. But we've clearly heard it from you that it is not so safe for our babies. Proning the baby is not so safe for our babies. Maybe you can emphasize it too.
Yes, so I'll continue to emphasize putting a baby to sleep on their tummy is not safe at all. Tummy time, we've heard of something called tummy time where we can put our babies on their tummies. Tummy time is good. You can put the baby on their tummy, but when you and the baby are both awake and you are observing the baby, that is acceptable, because it helps them to develop their motor skills. It strengthens their neck, their arms, their back, their core, and they're able to move a bit faster than their counterparts who do not get tummy time.
Oh, so it can only be done when one of the parents or there is an elder that is closely watching
the baby. Yes.
Very good. Any other ways of preventing SIDS?
So again, I want to talk about the babies who sleep with their parents in the beds, because this is something that commonly happens in our setting. We need to address it. So there are so many ways in which a baby sleeping with the parents is at risk. One of them is they can get smothered by maybe an arm of the parent, or by the clothing, the different bedding, but also we need to protect these babies. One, the important thing is to make sure that the baby is in a safe space. We would prefer that the baby doesn't sleep between
between the parents.
adults.
I thought when we have our little one, especially our first baby, we would want to share the love.
Please, let's do that when they are awake. Let's get that cuddle time when the baby is still awake. However, during sleep, let them be to the side, preferably near the more alert adults who can keep checking them. And most times, it's mothers. Sorry, dads, but that's the truth. So put them on the side and make sure also that mattress is also firm enough so that the baby, as the baby turns their head, they are not putting their nose into a soft sort of surface that can easily hinder their breathing. But also from time to time, someone should wake up at night and check where the baby is. As they grow, they tend to roll around and they can end up somewhere in the bed and people are kicking them, or somewhere on the floor. So we need to be careful as we sleep with babies in the same bed. Okay. But the biggest recommendation is if you can get a separate bed for a baby, please get it and let it be in your room too.
Thank you. Any other ways we can prevent SIDS? So
still dealing with sleep factors, I had explained earlier, loose beddings are not good. So try to tuck in the beddings into the bed and make sure they cover at least to the chest of the baby. Also, research has shown that using pacifiers as you're putting a baby to sleep also helps to prevent or to reduce the risk of SIDS. So as you put your baby to sleep, most of us, the baby is screaming, you just put the pacifier in. And then as they suckle on it, they feel comforted and then they drift off to sleep. That is good. That keeps their brain center stimulated too.
As they are suckling through their sleep.
Yes. However, if it falls out, do not force it back in.
Because you're going to push the tongue backwards and make things actually worse.
Yes, exactly. So a pacifier is good when you put in the baby to sleep, but once they have slept, if it falls out, let it be.
Okay.
The other thing is, we want toys to be with the babies all the time.
We want to decorate that cupboard. If it is a girl, let it be all pink. Blue,
you have
boys.
The lighting one, the singing one, and all of them are all over the bed. That is not good. They increase the risk of a baby getting maybe suffocated by one of them, or just not being in a good position to sleep well because maybe their nose got in contact with one of the toys. So it is important to keep our sleep environment and our sleep surfaces safe, but also warm to a good extent. Do not overheat the baby. So the other thing I'll address are the maternal factors. One of them that I talked about is smoking. Smoking is not good for the baby. I know
because it affects their brain.
Yes, it will affect, the nicotine can affect their brain, and long before even they are born. During pregnancy, pregnant mothers should not smoke. Everything a mother takes in has the potential to affect the unborn baby. Yes.
Thank you very, very much. Now, Dr. Charity, something very interesting. You see, we African mothers love our sleep. But again, we have to feed the baby, even through the night. We have to wake up and feed the baby. So sometimes we feel more comfortable removing the breast, put it in a baby's mouth, and then we sleep off as the baby is suckling. Sometimes I've seen cases of parents that put the baby on a pillow, and then they put a bottle in the baby's mouth, and then the mother leaves the baby in their crib with a bottle in the mouth. Does it increase the risk of SIDS, and what do you have to say about it?
Yes, definitely, Dr. Helen. Thank you for raising these points, because they happen more often than not in our setting, and they are very, very dangerous things to do to your baby. Putting a breast on a small little infant and sleeping off, one, it is, I understand we are overwhelmed sometimes, we are tired, but it is negligence. You are not being good to this baby, you are not being kind to this baby. This is someone you're supposed to take care of, you're responsible for, and we should be able to do everything in our power to give them a chance at a long life. So usually our breasts, or mothers' breasts, are heavy and fatty, and they are now on the baby. Like, so usually even when you're breastfeeding, a mother is breastfeeding, they are requested to hold the breast so that they block it from they prevent it from covering the baby's nose. But in that case, the mother is asleep and the breast is God knows where, and that is very dangerous. Also, just putting the baby on a pillow and leaving a bottle with them, they have no control about where those items could go, and so this could increase their risk of getting breathing issues and then sudden
choking.
death. Yes.
Okay, Dr. Charity, in a minute, I would ask you to give your last words to our viewers about SIDS.
Okay, thank you, Dr. Helen, for inviting me today to speak about SIDS, because it is something that the public needs to know about. To the viewers, I hope you've learned something today. SIDS is unexpected in otherwise healthy babies, so it is very devastating to families. I hope you've learned a few risk factors today, and if you have any of these risk factors on your baby, I hope that for the ones which you have control over, that you're able to modify them today. Get a good bed for the baby, get a good mattress, shift the baby to sleep with you in your room. Avoid overheating the baby. Stop smokers from hanging out around your baby. Do what is within your power, because we might not be able to prevent it totally, but we can work together to reduce the risk significantly of SIDS happening to our babies, for happier families. Thank you.
Thank you very much, Dr. Charity, for teaching the world, and I'm very sure parents out there have learned a lot about SIDS, and we are going to work. Remember, raising a child involves a community, so as we are teaching them, I believe they are going to implement these strategies, and we are going to reduce this unfortunate incidence that is taking the lives of our little ones. So you've heard it from the expert, dear viewers. SIDS is with us. I can tell you, I've seen 2 cases this year of a parent who has taken a child. One was, I think, about 4 months, and another one was coming close to 6 months, that these 2 were taken to bed very healthy. No illness, they had even suckled very well, but to their dismay, the little ones were found not breathing in their bed. So SIDS is, or sudden infant death syndrome, is here with us, and like she has told us, be very careful, avoid smoking, and the good thing, the Ugandan government is putting serious emphasis on laws that prevent us from smoking, especially during especially in the public places, because passive smoking as well can affect our little ones. And be very careful as you're putting your little ones to bed. Remember, it is the duty of both parents to give security and protection to your little one. So I know you may be very tired, having been running several errands, but remember, you may have put in so much effort towards the life of our little one, but just 1 minute can shorten it. So putting an extra minute to make sure that our baby is lying nicely in bed with a safe bed, well tucked in, and waking up at intervals to check on a baby is very, very important, and ensuring that our baby is breathing. That is it we had this week on the Paediatric Voice, our weekly Wednesday evening plot where we discuss different childhood conditions and how best to make our children grow to productive adults. And remember, our target is to have a productive nation that is growing towards middle income, and maybe one day we can also eye the first income status in our nation. That is it we had. I've been your host, Dr. Helen Namsoke. Till we meet next time.
Sudden infant death syndrome, sometimes known as crib death, is the sudden and unexplained death of a baby younger than 1 year. It is a large category of unexpected infant deaths. The cause of sudden infant death syndrome is unknown, but research has shown that it is associated with problems with a baby's brain center that is responsible for the control of arousal from sleep, detect low oxygen levels, and buildup of carbon dioxide within the body. Globally, about 2,300 babies die to sudden infant death syndrome, with a known prevalence of about 38.4 deaths per 100,000 live births. Children less than 6 months of age are more prone to sudden infant death syndrome, with about 90% being lost in the first 4 months of their life. Proper precautions must be taken to prevent sudden infant death syndrome and save the lives of our little ones.